Hello viewers, welcome to Wellness in Focus channel, where discussions are held on topical health conditions and other health related news. Our team of qualified and licensed health professionals will be giving you overview of topical health conditions and their laboratory diagnosis, as well as recommendations of having a healthy lifestyle. The focus is to build a platform which offers short educative videos about health conditions for health professionals and anyone willing to acquire knowledge in health related issues. Secondly, the platform focuses on building a concerned global community who will be sensitive to their health needs and the needs of others. So stay focused, like the video, comment and subscribe to this channel for more educative videos. So in today's video we are discussing sickle cell disease and its implications in marriage. All comments are welcomed, and don't forget to like the video. Many people are married without knowing their sickling status and they had no complications, but a lot more too never checked their sickling status and they had complications. So we are coming to discuss the complication that comes with sickle cell disease as far as marriage is concerned, so that we can also prevent it in the near future. Now let's delve into the objectives for this video. By the end of the discussion, people will be able to understand sickle cell disease and its impacts on would-be couple, appreciate how sickle cell is inherited, understand the pathophysiology of sickle cells, know the clinical presentation of sickle cell disease, appreciate some recommendations for would-be couples as far as sickle cell disease is concerned, so that they can prevent it in the near future. Sickle cell disease occurs when an individual inherits hemoglobin S gene from both parents, that is in the homozygous state, meaning you inherit one gene from each parent, making two. Therefore, since it's an inherited disorder, impending couples are entreated to be circumspect in the choice of their partners. Sickle hemoglobin is an abnormal or variant hemoglobin of great clinical importance because of its high prevalence and worldwide distribution. The other clinical significant variant hemoglobins are hemoglobin D, hemoglobin C, hemoglobin E, and the rare type hemoglobin H. But among these, hemoglobin S is very critical. As we can see on this slide, we have the normal red cell and the sickled red cell. The normal red cell is bioconcave in shape, but the sickled red cell is sickled. Anytime it encounters stress, the shape changes to be sickled. The pathophysiology of hemoglobin. A red blood cell contains hemoglobin, and hemoglobin is made up of two portions. We have the hem portion and the globin portion. The hem portion is made up of iron 2 in a porphyrin ring, and the globin portion is made up of proteins, and so they are made up of amino acids. So there are types of hemoglobins. We have the embryonic hemoglobin like Portland, GAWA1, GAWA2. Then we have the fetal hemoglobin, that is hemoglobin F. Then we have the adult hemoglobin, hemoglobin A. Then we have hemoglobin A2. Now let's take the adult hemoglobin for instance, A. The adult hemoglobin A is made up of the hem portion, then the globin portion. The globin portion is made up of proteins, and of course they are made up of amino acids. So, and the globin portion has two sides. We have the alpha chain, then the beta chain. So there is glutamic acid at the position 6 of the amino acid position of the globin part of hemoglobin A. There is glutamic acid at the position 6. So in the case of sickle cell disease, the glutamic acid has been removed and replaced it with valine. So you find valine at the position 6 of the amino acids in hemoglobin S, and that causes them to be sickled. So hemoglobin S is formed when valine replaces glutamic acid at the 6th amino acid position in the beta globin chain of hemoglobin in the red blood cells. So in the deoxygenated state, hemoglobin S has a poor solubility, forming polymers in red cells. The polymerization causes red cells to be rigid and distorted, adhering to the vascular endothelium. They are easily trapped in the spleen, then hemolyzed. And that brings a lot of crisis to sickle cell disease patients because their red cells are easily trapped in the spleen and hemolyzed. Therefore, they are always sick and hospitalized. The disorder is inherited in a simple Mendelian inheritance when both parents are carriers of the sickle cell traits, that is, in heterozygous parents. So if we have AS parent meeting, there is 25% chance that a child will be A, and that is normal, and then 50% that a child will be AS, and that is a carrier of the sickle cell traits. And then we also have 25% chance that a child will be SS, that is a sickle cell disease patient. So if we have AS and AS meeting, there is 25% chance that one of the child will be a sickle cell patient. Few of the clinical presentations are splenomegaly. This is noted very early, like after 6 months. Dactylitis, yellowy skin and eyes, dizziness and fatigue, pain, especially in the chest, abnormal breakdown of red cells, then finally mortality in adult life. Okay, so now let's talk about the lab investigations done on sickle cell disease. In the lab, we do complete blood count, which gives us a count of all the blood cell lines and the red cell indices. The HB would be low and the red cell indices will also be affected. We also do HB electrophoresis. This is a test used to separate the proteins of the hemoglobin, and this helps to identify if you are AA, AS, AC, DC, and others. The third one is also do Sickling light test. This is actually the first line of test done to confirm whether you are negative or positive to hemoglobin S or Sickling. So if you don't know your status, kindly walk into any hospital or lab, get checked. It's very important. Finally, there are some recommendations that wellness team recommends for would-be couples or people in love to consider before proceeding to the altar. First, couples are strongly encouraged to check their Sickling status before being engaged or falling in love. Second, people with AS or carriers of sickle cell trait are not to marry AS because there is 25% chance of giving birth to a child with sickle cell disease. People who are SS can still marry AA people without giving birth to SS. Meanwhile, all their children will be heterozygous or carriers of the sickle cell trait. Finally, it is very devastating to put the health of your child in jeopardy. Get checked before falling in love. Thanks for watching this video. Like and comment on this video and subscribe to this channel for more updates. Thank you.